Welcome to On the Beat, everyone. I'm Troy Thompson. Joining me in the studio today is Dr. Anna Woodson from the Dermatology Clinic. And today we're talking all about fillers and their role in the growth of demand for anti-aging treatments. I love this topic. Hello, Anna. Nice to see you again. All right. Fillers. I think it's one of the best things ever invented. For men and women.
Yes.
Because I've always said that if you want to look a little fresh, if you're a little fresher, and you can go and have this done, why not?
Yes.
I want to ask you, what is your favourite thing about doing the injectables?
So I think what's great is someone comes in with a concern, and I usually ask them, I hand them the mirror, and I say, what is your number one, number two goal? And they come in
I've never been asked that before. I like that.
They come in with that concern, and you can treat those 1 to 2 areas or more, and it's immediate. So they leave the exam room having had this treatment, and the results are, for the most part, pretty much immediate.
Okay, well, let's just break it down a little bit, because over the years of me doing these interviews, I hear people say, oh, Troy, I want to have Botox to get rid of all my deep lines. I'm like, well, that doesn't work. You need to do fillers. So explain the difference of what a filler does compared to a Botox injection.
So if you go to your dermatologist, they may actually recommend, depending on your needs, a combination of treatments. And so it's nice actually to do the toxin, the botulinum toxin, Botox is one brand, and see how much that settles your lines and your facial expressions, muscles of facial expression, and then come back with the filler potentially, you know, 1 to 2 weeks later, because it could change things up a bit. So a filler is going to add more volume. We lose that youthful volume over, you know, our lifetime. And the filler brings that back. And we inject areas in the face, but also the hands. Are an area that ages over time. And so it just adds some of that youthful volume back as one use.
Okay, women and men sitting at home, because we want everyone to know that men can have this done as well. And that's really growing in this market as well, I believe.
You're absolutely right,
and men are feeling a lot more comfortable about going to the dermatology clinic and having these procedures done. Explain to them at home what they're looking for to become the candidate to have this done.
So pretty much everyone's a great candidate. There's not really any negatives to having the procedure done other than a little minor bruising and bleeding. We usually tell people to do it enough ahead of a significant event in case you do have a little minor bruising and bleeding. You know, we arbitrarily say 2 weeks. But for the most part, unless you have a skin infection or certain rheumatologic disorders like lupus or things like that are a relatively small contraindication, but for the most part, everyone's a great candidate.
And I think that's great that you bring up those little few concerns, because we've talked in other segments that it's always good to tell your physician what medications you're on and your health history.
Yes, I mean, I would like to know if you're a female, if you're pregnant or considering to become pregnant, or nursing, because you probably don't want to do it in that instance. And then all about your past medical history, and certainly about any medications, because medications that are going to make you bruise and bleed more might be a relative contraindication.
Okay, explain to everyone at home, I've come in, I've had it done in my lunch break. What do I need to do at home? Do I need to massage, cold presses, stay off work?
Yeah, so the downtime is literally nothing. I mean, we may tell you to ice it for the next 15 to 20 minutes just to help with some of the swelling. But you can pretty much resume your normal activity. I mean, we tell people not to exercise for the rest of the day, but pretty much no downtime.
Well, Dr. Anna, as always, great information. You always give us such great advice.
Thank you.
Thank you so much. If you want to find out more about fillers and what they can do to help you and look that little bit younger, there's all the information up on the screen. Back after this short break.